I dropped my LDL cholesterol 50% in just 5 weeks. Then I told my friend who was high risk for a heart attack, 71 years old, and he dropped his cholesterol 68% in just 3 weeks while on a high-dose statin. This was miraculous. I found out I had many clogged arteries, 77%, 55%. This was shocking to me. Why? Because I was so fit. I thought my heart was the healthiest part of my body. I biked 100 kilometers a week. I do grand fondos. I climb up mountains. I did 30% of the Tour de France. So it was a shock to me. I had plaque, not only in my heart, but also my carotid arteries in my neck and probably elsewhere. And my only risk factor, high LDL. It was 168 milligrams per deciliter, which is 4.33 millimolars. What is the recommended LDL if you have heart disease? 2.0 or 80 milligrams per deciliter. I was double that. For severe heart disease like me, it's actually half of the 80, which is 40 milligrams per deciliter or 1.0 millimolars for you Canadians out there. This was my only risk factor. I thought I had a genetic risk factor, but no, I didn't have it. The blood test showed that my lipoprotein A was low. So that was also shocking. You can watch this video to see the top 3 foods that cause heart disease. So LDL is very controversial. Some people say it's not a risk factor. Some people say it's the biggest risk factor. In my case, it was the only risk factor. So I had to deeply consider, should I go on a medication, primarily a statin drug? So I looked at the data, and statins would drop the LDL cholesterol 30 to 50%. But would it reverse plaque? Very little. Then I looked at the other data, any diets that reverse plaque. There was this one diet that reduced LDL drastically, even better than the statins, and also reduced and reversed the plaque. I weighed my option and I chose the diet method. I thought I'd give myself maybe 1 month to 3 months. I'd recheck my blood in 5 weeks. And guess what? In that 5 weeks, my LDL dropped from 168 down to 84, 50% in those 5 weeks. And I had traveled for 10 of those days in that 5 weeks. This was astonishing. And in 3 months, I kept this up. And guess what? My cholesterol dropped down to. It dropped 64% from the 168, dropped down to 61 milligrams per deciliter. Now, the Heart Association, they recommend that if you have heart disease, your LDL should be 80 milligrams per deciliter. At about 80, your plaque doesn't grow. At 40 milligrams per deciliter, it can start to reverse and remodel, which is 1.0 millimeters for Canadians out there. Although I saw the data, it's surprising when it happens to you. So this is remarkable. LDL, reducing it down to this level. Later, when I examined my carotid, just 3 months after being on this diet, my cholesterol dropped from 168 to 61. I had 20 to 25% in both carotids, plaques. The thickness of the walls were worse than an 85-year-old's. And guess what? All gone. They didn't see any more plaque. The walls were normal size for my age of 55. So I'd reduce my vascular age in my neck by 30 years in just 3 months. I repeated it because no one believed me. Just a month later, same result. And the thickness of my wall even reduced further. So this is remarkable. And I'm here to tell you, to everybody out there, that heart disease is the #1 killer in the world. It's the #1 killer in developed countries. And it's silent. 600,000 heart attacks in the US, half of them, first presentation. People didn't even know they had heart disease. And then suddenly, they had a heart attack, but it's been building up for decades. And when it presents itself, it is sudden. And my friend who was 58, who was very fit, even fitter than me, he had climbed the Matterhorn mountain 3 times, summited it once successfully, and yet he died of a heart attack. Suddenly, on the morning he's supposed to fly up from San Francisco to Vancouver to have lunch with me. And that is why I got my own screening exams And without him as my teacher, I wouldn't have also known that I had heart disease. So I'm here to tell you, you should get the screening exams, and you can watch this video as well to see the number one test to get and the blood test to get to see if you have plaque in your arteries, in your neck and your heart.